Good.
And welcome back. Well, this month is DVT Awareness Month. DVT stands for Deep Venous Thrombosis, a serious, sometimes even deadly problem in your veins.
Dr. Deborah Manjoney is the medical director at the Wisconsin Vein Center and MediSpa. She's also a former heart surgeon, so she knows a lot about veins and how they should work and what happens when things go wrong.
That's right.
Great to have you here.
Thank
and actually,
you.
that experience and training that you had as a heart surgeon works really well with what you're doing right now, especially as it relates to treating veins.
Yes, it does. You know, obviously, veins are vessels that we've been working on, that I've worked on for years. And I've also gotten to see a lot of complications in hospitals from people who have DVT, because frequently they have to call in a heart surgeon when it's really a life-threatening situation with an acute problem. And DVT can lead to pulmonary embolism, and that's why, as heart surgeons, we're sometimes involved. A pulmonary embolism is when part of a clot breaks off, goes up the blood system, and actually goes through the heart and may get lodged in a major vessel going into the lung.
Okay.
And that's when it can actually kill instantaneously.
It goes through the heart?
Yes. Well, the heart provides, so the left side of the heart pumps the blood out through the arteries, but the right side of the heart collects the used blood from the veins, and then it projects it through the lungs before it can then come back into the left side to be pumped out. So the lungs give it the oxygen, give blood the oxygen. But in order to get to the lungs, you know, the right side of the heart has to push the blood through into these pulmonary arteries into the lungs. And if those get blocked, it's instantaneous death, basically.
And people don't know it's coming. People don't even know they have problems
Frequently
sometimes.
they don't at all. And you know, so the big things to be aware of: DVT, deep venous thrombosis, can be caused, number one, immobility. So if somebody's not moving around, it's a huge problem. And
Which
that's
happens after surgery
happens
sometimes.
after surgery, happens after injury, happens sometimes with pregnancy or in the postpartum period. You know, and it also happens, you know, with aging. And so that's why people who are older tend to get more of these, but it can happen at any age. We have seen people come in who had a history of having had this happen, for instance, when they're traveling on an airplane. Sometimes DVT is called economy class medical problem, because when you're in a little cramped seat, you can get into a position where you're not getting good blood flow through your veins, and so you can get a clot forming. And this is what you can see. You can see a swollen leg on the left side there.
Oh, that's the same person.
Same person, both legs. And so the left leg is very swollen compared to the right.
Yeah.
And it's his right leg, actually.
Right,
we're looking
but
at
on our left.
Right, on our left. But it's very swollen, and that's what can happen because the blood return is blocked. And so if you have a clot, for instance, in the thigh, the leg below that is going to be blocked off. The blood flow return is blocked, and so the leg is going to get swollen because there's too much blood.
Does it hurt?
It can hurt. It frequently hurts, but it does not always hurt.
Okay.
It can be silent. And it's especially a problem when somebody's had an operation on their leg or something, and so you can't distinguish discomfort from a DVT from recovery from an injury or recovery from surgery.
How is it diagnosed then?
It's diagnosed by ultrasound in the leg, and ultrasound's painless sonographic waves being put into the body to look at the veins to see if the blood is flowing in the proper direction. It's the same type of technique we use when we're diagnosing varicose veins and the proper direction of flow. We also look for blockages in those veins as well as deep veins when we're doing our initial screenings for people when they're presenting with varicose veins. But if it gets to the lungs, you might diagnose it with a CT scan of the lungs, where we're doing cuts specifically looking for clots in these vessels. But DVT is a very serious problem, and it is the most frequent cause of preventable hospital death. We see anywhere from 200 to 600,000 people a year dying from DVT causing PE in the hospital.
Wow.
So it's something for people to be aware of. Some of the things, as I said, get moving. That's one of the best things you can do to prevent blood from becoming stagnant in your blood system.
Even just walking is
Walking is very important. If you're sitting in a car for a long time, if you're sitting in a plane for a long time, do some heel-toe points and keep, you know, doing things to exercise your calf muscles, because then that's going to pump the blood out, and it's going to be a much more active blood flow.
And is that why? Because sometimes I feel like they rush people after surgery or even after pregnancy to get up, to start walking. I'm like, hey, let me rest a little bit.
Get up
but
and
that's
get moving.
why.
Absolutely it is.
And what about, because you'd mentioned varicose veins, and I'm wondering, are either varicose veins or spider veins, which I know tend to be more cosmetic, are either one of those either precursors, or do those present a risk for this type of
varicose veins can indeed be precursors, can be people who have varicose veins definitely have an increased risk for DVT compared to the regular population who don't have varicose veins.
Because they already have problems
That's
with...
right. They have valve problems, and especially if you have varicose veins in the thigh, and you get what we call superficial phlebitis, which some people get. You know, it's red and painful, and it's usually just in the varicose vein. And many times doctors just say, oh, you just have a little phlebitis, just use a little heat, take some aspirin or take some ibuprofen. The problem is, if you've got that DVT, I mean that superficial phlebitis, especially in the thigh, and you have varicose veins, that can easily get into your deep system because there are no working valves anymore. So you have nothing to prevent the superficial vein, where you have this little phlebitis, from actually causing the clot to go right into the deep system and up. So it can be very serious.
Okay.
Well, it sounds like people need to see a professional. Obviously, you know very well what you're talking about. So here's the information for Wisconsin Vein Center and MediSpa. You can go in, even if you have spider veins, varicose veins, or think you might have DVT or know you do, it's a good place to go. Georgetown Drive in Pewaukee. The phone number to call for an appointment is 262-746-9088 or wimedispa.com.
And we
online.
are doing free vein screenings throughout the month of March.
Oh, I'm glad you
Perfect.
mentioned that because
Yes.
it's Awareness Month.
Yes.
Okay,
Great.
so free screenings if people call to set up an
Absolutely.
appointment.
Yes.
That's awesome. Thank you so much.
Thank
Thank you.